Hello everyone, I'm Jianglan Long, come from Beijing Friendship Hospital, Capital Medical University. It's my great honor to share with you our research, integrated biomarker profiling of the metabolome associated with impaired fasting glucose and type 2 diabetes mellitus in large-scale Chinese patients. Diabetes is a metabolic disease that is an important cause of mortality certain people's health, with the prevalence rate increasing year by year worldwide. Diabetes has become one of the three major diseases. Due to a large-scale population and serving age, China has the largest number of the diabetic patients in the world. The results of two large-scale epidemiological studies in China showed that the prevalence of diabetes is increasing gradually, and the prevalence of prediabetes exceeds 35%. Indicating nearly 500 million people in China are pre-diabetes. However, most people ignore pre-diabetes due to the low diagnostic rate. Pre-diabetes is not only a transitional stage of diabetes, but also a risk factor for asthma, depression, and other diseases. The diagnostic criteria for prediabetes is blood glucose, as defined by the World Health Organization and American Diabetes Association. But due to the influence of factors such as fasting states and sampling time, the detection of blood glucose fluctuates scrutiny, and the results are difficult to arouse people's attention, which causes such a large-scale incidence rate and highlights the consequences of prediabetes. As the disease progresses, prediabetes could develop into diabetes, which could cause serious complications if not well controlled. Importantly, prediabetes could be reversed through lifestyle or therapeutic intervention, in which the core is only diagnosis and immediate intervention. To establish the key technology of early diagnosis of prediabetes is a prerequisite. Genomics, proteomics, and metabolomics that study genes, proteins, and metabolomes are currently high-sensitive technologies for the prediction and diagnosis of various diseases. Systematically studying the changing of all metabolomics provides possibility for establishing key technology for early diagnosis of prediabetes. This is because the detected metabolites are the terminal embodiment of complex biological events, which not only reflects the changes of genes and proteins, but also reflects the influence of other factors, such as environmental factors and gut microbiota. At present, studies on prediabetes and diabetes show that metabolic markers have well predictive and diagnostic value, while the metabolic markers of prediabetes and diabetes are scheduled and isolate, and most studies are conducted in a single center or non-targeted metabolomics with low reproducibility, which might be less effective to reflect the clinical application value of markers. From the perspective of system biology, combined with the complex biological mechanism of diseases, The metabolic markers of prediabetes and diabetes should be integrated for overall assessment. We think that integrated biomarker profiling formed by quantized biomarkers of diseases appears to be a useful tool for the objective representation of holistic changes in biomarker concentrations. However, there is a lack of integrated biomarkers profiling analysis related to the occurrence and development of prediabetes and diabetes. Therefore, our study aims to construct the integrated biomarker profiling of prediabetes and diabetes through metabolism, which could reflect the disease state and internal interference, forming an overall evaluation combined with bionetwork. It needs analysis technology with clear biological network, reasonable logical reasoning, and accurate quantization identification. Artificial intelligence technology has the ability of machine learning, network analysis, logical reasoning, intelligent analysis of complex biological events, capture key information, and intelligent identification, which provides the analysis technical support for the construction of integrated biomarker profiling. We consulted metabolomic studies on human diabetes in the early stage, according to the inclusion criteria. We conducted a meta-analysis of metabolomics related to diabetes, and the results showed that patients with prediabetes and type 2 diabetes could be distinguished by quantitative metabolic profiles, such as branch chain amino acid and aromatic amino acids. On this basis, with the support of the National Great New Drugs Development Project of China, we recruited nearly 7,600 patients from 5 clinical centers in 3 regions, Beijing, Zhengzhou, and Kaifeng. According to the inclusion and exclusion criteria, 1,705 subjects were finally included, based on the World Health Organization's diagnostic criteria of diabetes. The subjects were divided into normal glucose tolerance, impaired fasting glucose, and type 2 diabetes mellitus. Further, the research design was divided into 3 phases: discovery, test, and validation according to the clinical center of subjects. In the discovery phase, non-targeted metabolomics was performed to screen and identify biomarker candidates of impaired fasting glucose and type 2 diabetes, which was used to identify potential biomarkers in the test phase. In the validation phase, targeted metabolomics was conducted to construct the integrated biomarker profiling. In the discovery phase, after screening and identification, 31 and 42 biomarker candidates were identified in the sum of impaired fasting glucose and type 2 diabetes patients respectively, meaning including amino acid, catenin, phospholipids, and so on. Further, after logical regression analysis and receiver operating characteristic curve analysis, 41 metabolites were regarded as the potential biomarkers of impaired fasting glucose and type 2 diabetes in multi-center in the test phase, and the identification of the metabolism is occurred through qualitative analysis, in which the identification occurrence rate of 16 potential biomarkers is 100%. As known from the enrichment of metabolic pathway results, there was interrelated between various metabolic pathways. For example, the synthesis and degradation of branched chain amino acids could be correlated with glycerophospholipid metabolism through Krebs cycle, which further supports the construction of integrated biomarker profiling that reflects the bionetwork of disease occurrence and development. Therefore, in the validation phase, after methodological validation, we targeted the quantification of identified characteristic 16 potential biomarkers, including glutamine, valine, and so on. Significant differences were found in the assumed concentrations of the potential biomarkers. Further, the dataset was segmented as the training site and the test site used the 17 to 30 method. The models were trained with the training site to approximate the parameters. Then the test site was used to evaluate the performance of the model. To explore the most suitable modeling algorithm to construct an integrated biomarker profiling diagnostic model of impaired fasting glucose and type 2 diabetes, we compared the performance of diagnostic models from 3 different machine learning methods: extreme gradient boosting, logistic regression, and support vector machine. According to the area under the curve, extreme gradient boosting was used to construct the integrated biomarker profiling diagnostic model. In order to improve the specificity and sensitivity of the diagnostic model, gene impurity, mutant information, and analysis of variance were used to determine the best subsets of potential biomarkers. According to the results of gene impurity, the model achieved the best performance when it was constructed with 10 potential biomarkers. So, the importance of potential biomarkers was recorded by gene impurity, and the integrated biomarker profiling was constructed with top 10 potential biomarkers. We have not only constructed the integrated biomarker profiling that feature a network of biomarkers that are related to impaired fasting glucose and type 2 diabetes, but also established a shared surveillance website of the integrated biomarker profiling to the public. Input the constitutions of 10 potential biomarkers of the subjects. We can get the corresponding predicted values through intelligence analysis and predict the status of the subjects about diabetes according to the predicted values. From the evaluation results of the test set, the predictive accuracy of the integrated biomarker profiling exceeds 18%. Based on metabolomics and artificial intelligence, we construct the integrated biomarker profiling of impaired fasting glucose and type 2 diabetes, which provides important experimental evidence for early diagnosis, prevention, and treatment of prediabetes and diabetes, and provides clues for further exploring the pathological mechanism of diabetes. The study has been anchored by Professor Phillips from Emory University. To improve the diagnostic performance of integrated biomarker profiling, we designed a prospective cohort study, which is ongoing. In addition, a clinical sample database has been constructed, and the established distinction technology and analysis technology have been protected by national patents. And the patent, integrated biomarker profiling for assessing the risk of impaired fasting glucose and type 2 diabetes mellitus, is being translated into application. Finally, I would like to express my sincere gratitude to the National Great New Drugs Development Project of China, Beijing Friendship Hospital, Capital Medical University, and the subjects recruited in 5 clinical centers from Beijing, Zhengzhou, and Kaifeng, which made this study go smoothly. Thank you, everyone. It would be better if there is a chance to cooperate in future. If there is any question to discuss, you can contact me. Thank you again.